Very good afternoon, dear students. Today in this video lecture, we are going to continue with our next topic, that is arthropod bone infection. Okay. So in this lecture, the key highlight will be on chikungunya, on dengue, malaria, trachoma, and all the diseases that are caused due to arthropods. So let's start with our lecture. Arthropod forms a major group of disease vectors with mosquitoes, flies, sandflies, lices, fleas, ticks, and mites, transmitting a huge number of diseases. Many such vectors are hematophagous, which feeds on blood at some or all the stages of life. And if we have to characterize it into different parts, arthropods, we can characterize it as viral, bacterial, parasitic, ricketics, and spirotical. And under this, if we talk about the diseases that are associated with them, the viral has yellow fever, encephalitis, dengue fever, ribs, valley fever. If we talk about bacterial, it's plague, and parasitic, malaria, filariasis, and leishmaniasis. Okay, so let's move on to the topic that we have to discuss, that is chikungunya. Okay. The slide first of all, so that okay. So let's continue with dengue fever. Later on, we will discuss on chikungunya. So what is dengue fever? Dengue fever is a communicable arthropod-borne viral hemorrhagic acute febrile disease of short duration and varying severity. It is endemic in South Asia. Dengue type 1, 2, 3, and 4 are now endemic in Africa. In recent years, outbreak of dengue fever has occurred on east coast of Africa from Mozambique to Ethiopia to South Arabia. Here you can see in the pictures, the red zone depicts the area with Aedes aegypti and dengue epidemic activity, whereas the map with the beige color shows the area infected with Aedes aegypti. Now the causative agents for dengue. Viruses of dengue fever are of 4 types, namely 1, 2, 3, and 4. And we talk about the reservoir, man mosquito cycle in tropical urban centers. A monkey mosquito cycle may serve as a reservoir in South Asia and West Africa. If we talk about the mode of transmission, it's due to the bite of infective Aedes aegypti mosquito. Okay, so you know the name of the mosquito. What it is? Aedes aegypti mosquito, and it causes dengue. Okay, so this picture shows the life cycle of Aedes mosquito. That after 1 or 2 days of pupae, it ruptures and gives rise to a mosquito. That mosquitoes, female mosquitoes, after the mating lays eggs, and that are in the terms of thousands. And after 2 to 3 days, these eggs get converted into larvae. And after 4 to 5 days of that larva, they forms pupae, from which the cycle repeats itself. Here in the pictures which is shown below shows 4 bottles, in which first one contains the eggs, second one larvae, third one pupae, and the fourth one shows the adult. Now how is dengue transmitted? Now mosquito feeds on humans infected with dengue virus. And then there is extensive incubation period, that is of 8 to 10 days, and that mosquito infects other uninfected humans and the cycle repeats like this. If we shows the clinical picture of this disease, there is sudden onset of fever for 3 to 5 days, intense headache, rash, early generalized erythema, and mucopapillary rash that you can see in dengue fever. A patient that is suffering from dengue will have these kinds of symptoms. Okay, that is headache in the middle of the sorry, in the center of the ears, eyes, and rashes will be seen on the back of the patient. There will be minor bleeding, that we can also say epistaxis, gums bleeding, and PTX. Generalized bleeding and lymphadenopathy are some of the generalized features of this dengue fever. This picture shows all the symptoms. As you can see in the picture, the high fever, headache, muscular and joint pain, pain behind eyes, skin rashes, vomiting and bleeding from mouth and nose. These are some of the symptoms that distinguish dengue from other fevers. Okay. Now, what are the manifestations of dengue virus infections? Now, there are two types of fevers. The first one shows that is with symptoms and without symptoms. If we talk about with symptoms, there are we can characterize into three more parts. That is no different from other fever, and dengue fever with syndrome. Dengue hemorrhagic fever is also a clinical manifestation which comes under dengue fever with symptoms. And if we talk about dengue fever syndrome, it's for usually two types. The first one is without hemorrhage, and the second one is with unusual hemorrhage. If dengue hemorrhage fever, that is DHF, we can also classify into two parts, that is no shock and dengue shock syndrome. Now, what are the prevention and control? The first one is environmental sanitation, that is very must for it. That is eradication or control of mosquitoes vector, human protection against mosquitoes. The second most important point is health education, educating people regarding prevention. Okay, that's all for dengue as of your syllabus. There are some other diseases as well which are caused by Zika virus, but we will be carrying on with malaria fever. Let me get to that slide. Okay. So what is malaria? Malaria is a disease caused by a parasite. A parasitic re-emerged disease. As per the World Health Organization report, malaria kills about 2,000 children every day. Okay, so 1 million deaths per year in world, mostly young African people. Recently, multiple foci of drug-resistant malaria are encountered in different areas, tropical and subtropical areas. Okay, here you can see in this map, world map, which shows high threat, moderate threat, and low threat, and little or no threat areas. And India comes under high threat area of malaria. Now, let's talk about its causative agent. Protozoan parasitic with asexual and sexual phase, Plasmodium vivax, Plasmodium falciparum, Plasmodium ovale, and Plasmodium malaria. These are four types of mosquitoes which causes this malaria. and there is mixed infections which are not infrequent in an endemic area. Okay, now about the reservoir, humans. Only important reservoir of humans are malaria. Case may have several plasmodium species at same time. Infective stages to vector is gametocytes, which have to be mature, both sexes, sufficient density and viable. Anti-malarial drugs lose viability of gametocytes. Female Anopheles mosquito is definitive host, and infective stage to man is sporozoite. That must be remembered and is very important as far as your examinations are concerned. Now the period of communicability. As long as infective macrogametes are present in blood of patients, this varies with parasitic species. In untreated case, it may reach up to 3 years. However, with anti-malarial drugs, the period is shortened greatly. Humans may infect mosquitoes as long as infective gametocytes are present in the blood. This varies with parasite species and with responses to therapy. Untreated or insufficiently treated patients may be a source of mosquito infection for 1 to several years. Transfusion transmission may occur as long as asexual form remains in the circulating blood. Stored blood can remain infective for at least a month. This diagram shows the cycles of Plasmodium, where the mosquito first bites you, then the larva gets converted into sporozoites and hepatocytes, merozoites, and that gets into the arthrocytic stages in the bloodstream, where they get converted into mesozoites, and as sexual cycle happens, and trophozoites get converted into schizoids. That is, after that, the sexual differentiation occurs, and stage 1, stage 2, stage 3, stage 4, and stage 5 occurs. And that again, this entire process is happening in liver and plasmodium. So let's continue with malaria. Now the modes of transmission, if we talk about malaria, is bite of infective female Anopheles mosquito, where the sporozoites are present in the salivary gland, and most species feeds at night. Some important factors also bite at dusk or in the early morning. Infection or transfusion of infected blood or use of contaminated needles and syringes may also transmit malaria. Congenital transmission occur rarely, however, pregnant women are vulnerable than other to falciparum malaria or possibly other Plasmodium species. Malaria transmission cycle, if we have to state, is first the infected person, liver infection, infected RBCs, second mosquito infected, now the second person gets infected. The incubation period, time between infective bite and appearance of clinical symptoms is 9 to 40 days. 9 to 40 days. With incubation period, time between infective bite and appearance of clinical symptoms is 9 to 14 days according to types of malaria species. With infection through blood transfusion, incubation period depends on the number of parasites infused and are usually short but may range up to about 2 months. Susceptibility. It is universal except in humans with specific genetic traits. Age. All ages are effective. Tolerance to clinical disease is present in adult. present in adults in highly endemic areas are exposed to infective anopheles is continuous over many years. Like males are more exposed usually due to outdoor life. Immunity, no natural immunity. Infection includes species-specific immunity, some sort of active immunity depends in endemic area. You can see in these pictures that normal cells and the infected RBCs with malaria. Clinical picture if we show about it's slowly rising fever, chills, malaise, headache, nausea, lassitude, muscle and joint pain, then rigor sensation and rapidly rising temperature, ending by profuse sweating. The cycle of fever, chills, sweating is repeated either daily or every other day or every third day of or irregular according to malaria species. Relapses may occur after a period of cure without parasitemia at irregular interval up to 5 years. Now the symptoms of malaria. Centrally, if we talk about its headache, skin, chills and sweating, systemic fever and muscular fatigue and pain, back pain, respiration dry cough, spleen enlargement, stomach nausea and vomiting. Complication if we talk about its anemia, splenomegaly, abortion and fetal infection. Falciparum malaria may be associated with respiratory distress, jaundice, liver failure, encephalopathy, pulmonary and cerebral edema, coma and death. If we talk about diagnosis, malaria parasite in thick blood film, repeated microscopic examination every 12 to 24 hours may be necessary to cover all parasite species. Several tests have been developed. The most promising are rapid diagnostic tests, plasmodial antigens in blood, PCR, most sensitive method, demonstrating antibodies which appears after first week of infections but may persist for years, denoting past malarial infection. If we talk about prevention, general prevention measures of arthropod-borne disease, environmental sanitation, vector control, and health education, elimination of breeding sites of mosquitoes, eradication of larva stages by spraying crude oil and larvicides on water surface, destruction of adult mosquitoes by using suitable insecticides, liquid aerosol, pyrethrum, human protection, screening of windows and doors using bed nets and animal barriers between breeding places and human habitation, using protective clothes, apply of repellent to exposed skin between dusk, avoid going outdoor and down when Anopheles mosquitoes commonly bite. If we talk about health education, it's public at risk group and travelers. Avoid taking blood from any individual giving history of malaria or a history of travel to or residency in a malarious area. If we talk about the measures that must be taken, that chemoprophylaxis for international travelers going to endemic area, chloroquine or hydroxychloroquine 5 mg per kg per week or chloroquine phosphate that is 500 mg for average adult must be given to the patients. Continued for 4 to 6 weeks after leaving endemic area. In area with chloroquine resistance, Plasmodium falciparum mefloquine is recommended. that is 5 mg per kg per week for adults, and 1 to 2 weeks before travel, during stay, and 4 weeks after leaving endemic area. Now let's talk about filariasis. Also known as Bancrofttian filariasis. It is endemic in many tropical and subtropical countries like Africa, Asia, Western Pacific, and part of America. Filariasis in Egypt. It is endemic in Egypt, Nile Delta, Qualobia, Menofia. In the Upper Egypt, that is Giza, a program for elimination of lymphatic filariasis started in 2002 and showed successful results. Nematode and other long thread-like worms. Adult worm normally resides in lymphatic of infected people. Female worms produces microfilaria that reaches bloodstream 6 to 12 months after infection. The microfilaria appears in large numbers during night with maximum density in blood between 10 p.m. and 2 a.m. Reservoir of infection. Human with microfilia in their blood. Man is definitive host and mosquito is intermediate host. Period of communicability. Humans can infect mosquito when microfilaria is present in peripheral blood. They can persist for 5 to 10 years or long after infection. Mosquito become infective after about 2 weeks. And about the mode of transmission, if we talk in Egypt, female culex patents, but it could be transmitted by bite of Anopheles, Gambiella, and Aedes. Mosquito cycle begins with microfilaria are ingested by female mosquito during feeding. Microfilaria penetrates stomach wall of insects and develops in thoracic muscles into elongated infantifilariform larva that migrates to prophagus. When mosquito bites an individual, larva can enter punctured skin, then passes by lymphatic, where they mold and become adult. So that's all for these three main diseases that are associated with arthropod. In the next lecture, we will continue with this arthropod as well. Till then, thank you very much for attending this video lecture. I hope you like this, and please share, subscribe our channel.